And good morning, good morning, good morning. It is 6:19 a.m., 6:19 in the morning on Tuesday, August 29th, year 2021. My name is Mark Kulak, and we are continuing on with our reading on the 2023, I think it's February 2023, article out of the Yale Law Journal called the Antibody Patent Paradox. And we left off with the section called Written Description. And trust me, I am doing this as much so that I can listen to it in review as anyone else. So having the audio version of it is for other people to listen to. Yes, it could be good bedtime listening, but we're turning it into a series, just the narration of the Yale Law Journal article itself. Let's see how I do after having just woken up a few moments earlier before doing the family errands and getting something done. Perhaps I will be stumbling over so many words, I will regret the decision. So we continued off with written description, C2, which is in, are we in the second section here? C2, which is in the second section of the death of antibody patent claims. Written description. Much of the recent change in antibody law has happened in the written description doctrine. Again, the purpose of the written description doctrine is twofold: to prevent gun jumping, which is filing for a patent before the inventor has actually identified the invention, and, quote, late claiming, unquote, which is changing claims during prosecution to cover something the inventor hadn't yet invented at this time. So review, written description doctrine twofold: gun jumping, which is filing for a patent before the inventor has actually identified the invention. Note, they're saying identified the invention. Doesn't say that they have to describe all the details here anyways about how the invention is made, but also late claiming, changing claims during the prosecution to cover something that the inventor hadn't invented at the time. Some of the cases that began this written description revolution for antibodies did so in factual circumstances that fit pretty well into those traditional and reasonable purposes. In Noel versus Lederman, Lederman, an appeal of an interference proceeding before the Patent Office, the Federal Circuit cast doubt on some of Noel's broad claims to any antibodies, human, mouse, chimeric, or otherwise, that bound to CD40CR, which is a portion of an important protein in the inflammatory response. Like Chiron Corporation, CHIRON, which, by the way, it was a key topic in the book Big Shot AIDS Vaccine, which I've only read about half of into narration. I need to restart it and do it again because it involved so many people, including many associates and therefore indirectly Robert Malone, and was released the week after September 11th, 2001. But anyway, not to get too distracted on that. Important book. And mentions Nancy Haywood. Sorry. Like Chiron, Noel had only disclosed the murine sequence, it's the mouse sequence, but claimed the later developed, far more valuable chimeric, humanized, and fully humanized sequences. The Federal Circuit concluded that, quote, a patentee of a biotechnological invention cannot necessarily claim a genus. Only excuse me, let me restart this. The Federal Circuit concluded that, quote, a patentee of biotechnological invention cannot necessarily claim a genus after only describing a limited number of species because there may be unpredictability in the results obtained from species other than those specifically enumerated, unquote. As a consequence, Noel lost some claims on written description grounds. Unpredictability in the results obtained from species other than those specifically enumerated. Hence, the fact that there is a range of antibodies which can be created, all right, also means in a way, or I should say, we can apply from that, knowing just how much is unknown, right? That not only is there range, but we may not actually know how many different types of antibodies would work or could be present for a specific antigen in another animal. And therefore, since they don't know the range, right, as they said here, only describing a limited number of species because there may be unpredictability in results obtained from species other than those specifically enumerated. So you may not know all the ones in one species, and also, obviously, because different species can create different antibodies, there's also a range there that the patents probably couldn't describe because no one really knows the limit. And this, before I go on to the next paragraph, highlights one of the things that I believe, and this is speculation, okay, as the narrator's note, this is speculation. I suspect that a lot of this charade that we see here with the antibody patent paradox is happening because there's an attempt to hide from all of us, to mask that this isn't really about, in order to implement a lot of these technologies, I should say, let me rephrase that. The implementation of a lot of these technologies is also in and of itself ways to learn how the machinery works. There's so much unknown about not just the human genome, but all genomes really, and about the immune system, about ribosomes, about there's just so much still unknown about all of this machinery of life. Okay. That the implementation of these things is allowing the data collection to learn more about how they work. And to learn more about how they work, they need to implement something. All right. So this is it's kind of covering that up. I think, again, speculation. Too early. I probably should have waited a little while. Some of my trolls will probably say I should have waited another 100 years, but whatever. It's all good. It's all good. Noel, as a consequence of that, Noel lost some claims on written description grounds. As a general matter, the Federal Circuit's description of genus claims is consistent with its other life science cases. But the Noel court was the first to apply this understanding directly to antibodies and in the written description context. Noel unsuccessfully argued that, quote, because antibodies are defined by their binding affinity to antigens, not their physical structure, he sufficiently described the claimed antibody by stating that it binds to the human CD40CR antigen, unquote. On another narrator's note, isn't it interesting that we're trying to define, or over the last few years, so much of the description or the way that SARS-CoV-2 is being defined is by what binds to it. This whole concept of binding, even the attempts to define the DTRA domain program as nothing more than binding affinity analysis is bogus. I mean, binding is real, but the attempts to orient everything around that it's obviously so pronounced. It was, in fact, part of the lingo before the pandemic even really started taking off, if you will, early on. Like, oh, it's binding to this and the ACE and all this other crap. Lots of talking about the specific how things are binding. But as we read again here, Noel unsuccessfully argued that because antibodies are defined by their binding affinity to antigens, not their physical structure, he sufficiently described the claimed antibody by stating that it binds to the human CD4 antigen. Also, note how much attempts there has been to define or describe SARS-CoV-2 by what it binds to, as opposed to understanding that multiple things possibly could do that binding. Interesting. While this was standard black letter law in the 1980s, the Federal Circuit rejected the argument. This is all the way back in the 1980s. Because, quote, Noel failed to disclose the structural elements of the antibody or antigen in his earlier patent application, unquote. The court distinguished Noel's circumstance from that in ENZO, E-N-Z-O, the case that established the, quote, fully characterized antigen, unquote, test, because Noel had not fully characterized human CD40CR. Without disclosing the structure of the claimed antibody or its antigen, the court held that the contested claims had not satisfied the written description requirement. Notably, however, the antigen was well known at the time, as described in various pieces of prior art. Noel simply hadn't described its structure in his specification. The Federal Circuit, by changing ENZO's focus from, quote, structure, formula, chemical name, or physical properties, unquote, and, quote, specification to a deposit of the protein and a public depository, unquote, to structure alone, limited the universe of cases in which the patentee could rely on characterization of the antigen to provide a written description for the antibody. This universe was further circumscribed in 2011 in Centocor Ortho Biotech Incorporated versus Abbott Laboratories, a case that also involved an instance of likely late claiming and an effort to expand the patent to one genus of antibodies to cover a different and better invention by the defendant. We're going to read that sentence again. I did want to highlight that if you go to Wikipedia, aside from a sad little paragraph in the Janssen pharmaceuticals page, you will not find anything about Centocor. Hence, although certainly I don't have a nice long narration written about it, you'll have to go to HoustonicITS.com or Houstonic.live, go to the C's, scroll down to places, companies, other things, and you will find a page on Centocor biotech. I have a couple of articles fully included in here, written elsewhere from books, and a variety of newspaper articles where you can just read what was written about Centocor at the time. The pages that I have, the reference pages that I have almost zero narration on them. It's mostly evidence that's been collected. Now, evidence doesn't necessarily mean that's what the evidence describes is true or false. It just means it's evidence, right? You have to ultimately figure out yourself. But usually, there's a lot of factual data, dates and names, cases, revenues, etc. That obviously are truthful. But this will give you a good jump start on finding a lot of stuff. And how the company was described and their technologies over the time. Now, also, as I described in my long Sunday show here on Centocor here, first of all, Centocor did a lot of work with Vical, which is the company that Robert Malone has a lot of his patents with, early patents anyways. But this company, Centocor, was developed, or it was founded in Philadelphia in late 1980, really. And one of the key founders of the company was none other than Hillary Kaprowski, one of the three creators of polio vaccines in the 1950s. And Hillary Kaprowski is going to be a big, 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 big part of our story, all of our research of this new era of biotechnology. He was one of the co-founders of Centocor. Okay. Now, going back to our article here, the other thing to mention in here is this 2011 Centocor Ortho Biotech. So they had already been acquired and renamed Centocor Ortho Biotech versus Abbott Laboratories. Also, previously that was Genentech. Okay. This is a case that Les Weinstein worked. Les Weinstein, a top arbitrator in the United States. Les Weinstein, the first patent attorney hired by the United States Department of Justice Antitrust Division in the early 1960s, appointed by none other than John F. Kennedy. Les Weinstein, the father of Eric Weinstein and Brett Weinstein. Les Weinstein, still active. And as we just mentioned Robert Malone before, isn't it interesting that of all the places where Robert Malone does this big breakout on the Dark Horse podcast in 2011, he chooses the son of the lawyer and arbitrator that has handled that case, Centocor Ortho Biotech versus Abbott Laboratories. Now, there are probably some exceptions to this, but and I don't like to pump my own work, but make note of which channels and which researchers these days are talking about Weinsteins and Les Weinstein and the patent paradox, antibody patent paradox. You'll notice a lot of people will not tweet about it. They won't talk about it. They won't repeat it, and they won't highlight the series, and they won't mention it at all. And you should find that very, very peculiar, given how beep, 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 beep important this issue is. Anyways, let's reread this. The universe was further circumscribed in 2011 in Centocor Ortho Biotech Incorporated versus Abbott Laboratories, a case that has also involved an instance of likely late claiming and an effort to expand the patent to one genius of antibodies to cover a different and better invention by the defendant. But the change in the Federal Circuit's articulation of the legal standard was dramatic. It nixed the Patent Office's previous reliance on satisfying written description for antibody claims, even if the antigen was well characterized. Centocor consequently marked a bright line shift towards the Federal Circuit's full scope view of written description law for antibodies, akin to what it was doing in other fields at the same time. The claims in Centocor involved antibodies to TNF alpha, the overproduction of which can lead to inflammatory conditions like arthritis. Originally, Centocor and Abbott separately embarked on different research programs to develop antibodies for use in human patients. Centocor focused on adapting murine antibodies to TNF alpha for use in humans with the goal of producing a chimeric antibody. One was a mouse CDR to bind to TNF alpha, but a human constant region to trick the human immune system into not attacking the antibody as a foreign intruder. Remember, the antibody itself is nothing more than a protein manufactured by a ribosome somewhere. Now, an antibody, there are ranges of antibodies made at the molecular level. An antibody made to an antigen at a mouse is not going to be the same as one made to a human. Now, they may be close enough. They may be close enough that you could take the human one or a human one and put it into a mouse and it may work, or you may be able to take one from a mouse and put it in a human. However, because the human version of it or a human version of it is not made in the mouse may look at that antibody protein and go, that in and of itself is something foreign that needs to be destroyed. Same thing with the opposite. Hence, this whole field of antibodies, not only is there a range of shapes, a range of antibody proteins that can be made to a specific antigen based upon the species, but even based within the species. As a matter of fact, let's just say, and again, this may not necessarily be the case, but let's say there's a new type of pathogen, all right? It's possible that someone who is of, say, Sicilian descent will develop antibodies to it, and someone of Mongolian descent could make antibodies to it. But perhaps, these antibody proteins are just different enough that if you take the one from someone who is Sicilian and put them into someone who is Mongolian, the Mongolian body or DNA may go, this is also foreign, right? All of these permutations must be factored in. It's also possible that there could be massive ranges just within the Sicilian population based upon local diet, even more localized DNA. We don't know. The point is no one really knows. And not only will maybe they don't work, okay, but also in some cases they may actually be in and of themselves identified as foreign proteins, which need more antibodies made to them. You can see how this stuff can just escalate and get completely out of control. Really, really interesting. Wow, that is cool stuff. Wow. So they found ways to trick the human immune system by tweaking the antibodies. Wow. Centocor filed a patent application disclosing murine and chimeric antibodies in 1991 and filed various continuations in part until 1994. Also note, by the way, a little bit of a side note, narrator's note, there's been one of the bigger challenges with the pursuit of monoclonal antibodies is it takes time to make them, right? You can't just press them out in a machine, if you will. They need to be made using organic methods. That's how we know how to make them right now. Not like you just throw the chemicals into a vat and boom, there's your antibody. They still need to be made organically, which means you need to find enough people, enough whatever, animals, something. You need to manufacture them, and then you need to filter them and process them, et cetera, et cetera. It takes a while. If there was such a discovery as a novel pathogen, well, you're going to need to then start your whole production of antibodies from scratch upon discovery, in theory anyways, unless you just happen to know what was going to leak a long time ahead beforehand. One of the things that's been pursued here with this is something that the much maligned, and everyone loves to hate this guy, Michael Callahan, has been pursuing at the University of Alabama, which is, and another curious fellow who's lived up in Canada, name escapes me right now, who worked out of the Winnipeg lab, is using plants. Can you use plants? Plants can also make antibodies too. Maybe or at least you can use plants to manufacture proteins. So if you can discover the antibody or to make the antibody, can you use plants? Because you can very easily have a whole factory full of plants. And although it doesn't necessarily make them all overnight, it's a way to be able to scale up production, right? And humans don't like to be locked up, at least not to their knowledge, and used as antibody manufacturing for antibody manufacturing. At least they don't, as long as they don't know it, they're usually okay with it. So a lot of things there. Oh, also, and this is, ever hear something called ZMapp, which is the triple antibody, which the Huang Gaoqiao, the Chinese spy out of the Winnipeg lab, also was working on, and that is having 3 different antibodies fused to one backbone, hence allowing being able to connect, or I should say attach to multiple antigens, having it more flexibility, more powerful. And if you can do 3, why not be able to do even more than that? So a lot of thought's been put into these types of things. That was ZMapp, Z-M-A-P-P. Out of MAP Therapeutics, M-A-P-P. I think it was out of San Diego. Abbott pursued a different research strategy, however, and filed a patent application in 1996 for an antibody that was fully human, with both a human constant region and a human CDR. The patent was issued in 2000. Abbott's fully humanized antibodies were far more successful than chimeric ones. Gee, you don't say. Abbott used technology to create Humira, now the world's highest-selling therapeutic drug. So if you're watching this show right now and you're learning about antibodies with me and antibody patents, you now know that the world's highest-selling therapeutic drug, the highest-selling therapeutic drug, Humira, came out of the humanizing of the antibody, of this particular antibody, because the mouse variant wasn't effective enough. The human version, Humira, the human version, also known as adalimumab. Now you know Humira, the humanized version, because the mouse one wasn't human enough. No kidding. Many humans' bodies probably saw the mouse version and said this is in and of itself foreign and didn't want to use it. Isn't that interesting? Think of how much we're learning together because we are going down this path that no one else wants to talk about. Aside from Jonathan Cooey, PhD, on GigaHome Biological. Jonathan Cooey is in this with me. I suspect there's probably a few other people, but not many. A lot of other people want to get involved to a lot of other drama. We're talking about this stuff because this is really what it's all about. Or at least a lot of things connect to this. No pun intended on the binding domain. After Abbott obtained regulatory approval for Humira, Centocor filed additional claims to fully human antibodies. Centocor's chimeric antibody patents were still pending in 2002, so Centocor filed the new claims as part of the patent family and claimed priority to its 1994 applications. Centocor then sued Abbott on this late patent and won a $1.6 billion jury verdict. The Federal Circuit invalidated Centocor's claim under an invigorated approach to written description. The court reiterated that written description required an applicant to, quote, convey with reasonable clarity to those skilled in the art that, as of the filing date sought, he or she was in possession of the invention, unquote. Yet, in the Federal Circuit's view, Centocor's 1994 application did not adequately disclose a fully human antibody to TNF-alpha. The application disclosed instead only a chimeric one. And although human antibodies and human TNF-alpha were mentioned in the specification, It only provided amino acid sequences for a single mouse CDR. The Federal Circuit concluded that this amounted to, quote, nothing in the specification that conveys to one of skill in the art that Centocor possessed fully human antibodies within the boundaries of the asserted claims, unquote. Moreover, the court rejected Centocor's arguments that the Patent Office's guidelines allowed the disclosure of a fully characterized antigen structure to show constructive possession of antibodies that bind to them. The court explained that while, in some simple situations, possessing a protein makes it trivially easy to secure a complementary antibody, this was not so for TNF-alpha. Indeed, anti-TNF-alpha antibodies were already in the prior art. The challenge instead was finding an efficient and therapeutically tolerable antibody that bound to TNF-alpha in the desired way. But finding one essentially required a canvassing of all possible CDR sequences that met such requirements. In the court's view, Centocor's patent was therefore not like claiming a lock openable by a single known key, but rather claiming a lock with a, quote, ring with 1,000,000 keys on it, unquote. Centocor's claims were consequently found invalid for lacking sufficient written description. The door to claiming antibodies from their antigens closed further with AbbVie, AbbVie, Deutschland GmbH versus Janssen biotech. Unlike prior cases, the patentee in AbbVie, AbbVie, wasn't seeking to stretch its claims to cover a different form of the technology it hadn't invented. In AbbVie, the patents at issue were directed towards human antibodies that bind to the human protein interleukin 12, or IL-12. AbbVie's specification described amino acid sequences of about 300 antibodies with a range of binding affinities. Importantly, though, the patent described only one type of heavy and light chains, which shared, quote, 90% or more amino acid sequence similarity in the CDR, unquote. Wow, it is, narrators know, it is tough to speak with a particular level of sound, but do it quietly enough to not wake up the baby. It's hard. I'm actually getting winded here. It's crazy. Continuing on. While the accused product had different heavy and light chains with only 50% sequence similarity to AbbVie's disclosed sequences, it was nonetheless covered by AbbVie's claims. This is because AbbVie's claims were predicated on one aspect of the antibody's functionality, how strong the antibody bound to IL-12, interleukin 12, by a measure of its dissociation rate from the antigen. And in that respect, the defendant's antibodies were essentially indistinguishable from the plaintiff's. The mix of some The mix of some disclosed structure and functional patents, typical of antibody patents at the time, still failed the written description requirement. The Federal Circuit noted that when a patentee claims a genus, they must disclose, quote, either a representative number of species falling within the scope of the genus or structural features common to the members of the genus so that one of skill in the art can visualize or recognize the members of the genus, unquote. The court found, quote, no evidence to show any described antibody to be structurally similar to and thus representative of the accused product, unquote, and, quote, no evidence to show whether one of skill in the art could make predictable changes to the described antibodies to arrive at other types of antibodies, such as the accused product, unquote. AbbVie argued that its disclosure in describing a substantial number of antibodies with a range of binding affinities had disclosed species representative of what it claimed, which was, after all, antibodies with a range of affinities and not antibodies with a range of structures. The court called this an, quote, in opposite. That's an interesting, I never knew that was a word before. Inopposite, INAPPOS, an opposite attempt that, quote, merely recited a desired result rather than the actual means for achieving that result, unquote. The court warned that functionality-defined genius claims were, quote, inherently vulnerable to invalidity challenge for lack of written description support, especially in technology fields that are highly unpredictable, where it is difficult to establish a correlation between structure and function for the whole genius, or to protect what would be covered by the functionally claimed genius, unquote. AbbVie represented a fundamental shift away from the functional characterization of antibodies. It was a rejection in spirit, if not letter, of the Federal Circuit's allowance of such claims in Wan's hybrid tech Enzo, albeit in dicta, and the Patent Office's previous guidelines. In AbbVie, the antigen was fully characterized, and AbbVie provided hundreds of examples of antibodies that bound to its target antigen at particular places with particular affinity. This would have clearly met the standard in Enzo that written description could be satisfied by claiming functional definitions alongside disclosures of an antigen's structural characteristics, especially where, quote, the antibody technology is well developed and mature, unquote. Since AbbVie, this has no longer been enough. The Federal Circuit has come to fundamentally reject functional claiming of antibodies in a demand for structure. And as you can see, there's many, many, many references here. C3, Section 2, and we are in C3. Today, the death of the antibody claim. The most dramatic evidence of this demand for structure comes in two recent cases: Amgen Incorporated versus Sanofi, and Juno Therapeutics versus Kite, K-I-T-E, Pharmaceuticals Incorporated. In Amgen, the Federal Circuit held that the disputed claims were invalid under the enablement requirement because Amgen's claims were broad, functional claims that provided little guidance on how to recreate the full scope of the invention, anti-PCSK9 antibodies, without undue experimentation. And in Juno, the Federal Circuit concluded that Juno's claims lacked sufficient written description because, even though the patent included working examples of Juno's engineered immune receptor, the fact that other functional receptors existed and were not disclosed in the patent made the disclosure not, quote, representative, unquote, of the scope of the claims. In Amgen's 165 and 741 patents. I don't know what the full patent numbers are, so you'll have to forgive me. In Amgen's something 165 and something 741 patents asserted against Sanofi's product Proluent, Praluent, or alirocumab, alirocumab, You restart that sentence. In Amgen's something 165 and something 74 1 patents asserted against Sanofi's product Proluent or alirocumab describe antibodies which bind to pro-protein convertase subtilissin kexin type 9 enzymes. That's pro-protein convertase subtilissin subtilisin/kexin type 9 enzymes PCSK9, and which are enzymes important in the processing of cholesterol. By the way, remember, enzymes are just a type of protein. Shouldn't say just a type. They are a type of protein. By binding to PCSK9, these antibodies prevent the enzymes from binding to low-density lipoprotein, or LDL, low-density lipoprotein receptors, ultimately lowering LDL cholesterol, or bad cholesterol levels. The specification lists partial amino acid sequences for the CDRs of 26 antibodies and claims antibodies that bind at least one of 15 amino acids on the PCSK9 protein. At the first trial, the jury and the district court found the patents not invalid, and the court ordered a permanent injunction. But on an emergency appeal from the injunction order, the Federal Circuit reversed the underlying validity determination. It refused to permit Amgen to characterize a class of antibodies by reference to detailed knowledge of the antigen, even when coupled with a partial description of the antibody's genetic structure. The Federal Circuit pointedly took issue with the district court's jury instructions on Section 112.260. Section 112. Consistent with prior law, the district court had instructed the jury as follows, and this is the quote. In the case of a claim to antibodies, the correlation between structure and function may also be satisfied by the disclosure of a newly characterized antigen by its structure, formula, chemical name, or physical properties if you found that the level of skill and knowledge in the art of antibodies at the time of filing was such that production of antibodies against such an antigen was conventional or routine. Thus, the Federal Circuit stated, the Federal Circuit stated, would lead a jury to, quote, naturally understand the instruction to permit it to deem any antibody within the claim adequately described merely because the antibody could easily be produced and implicitly used as an antibody, unquote. This could not be the case, according to the appellate court, because the language of the district court's instruction, quote, does not even require any particular antibody to be easily made. All it requires is that production of antibodies, some, not all, against a newly characterized antigen be conventional or routine, unquote. In the Federal Circuit's view, this instruction ran afoul of the written description requirement as follows. And here's the long quote from the court. We cannot say that this particular context involving a newly characterized antigen and a functional genus claim to corresponding antibodies is one in which the underlying science establishes that a finding of make and use, which is routine or conventional production, actually does equate to the required description of the claimed products. End of quote. On demand, a second jury once again found that Sanofi had not proven the patents invalid, but the district court ultimately granted Sanofi's motion for judgment as a matter of law for lack of enablement. On a second appeal, the Federal Circuit upheld the district court's invalidity ruling. At the Federal Circuit, Amgen argued that a person of ordinary skill in the art could, quote, make all antibodies within the scope of the claims by following a roadmap using anchor antibodies and well-known screening techniques as described in the specification, or by making conservative amino acid substitutions in the 26 examples, unquote. Indeed, under the Wands factors, Amgen argued its claims, Indeed, under the Wands factors, Amgen argued its claimed invention required only routine experimentation. Experimentation made all the more routine by the development of antibody science in the intervening 30 years since Wands was decided. The court disagreed. It took less issue with Amgen's factual assertions than with prior Federal Circuit law. Quote, although Wands gave birth to its eponymous factors, unquote, the court wrote, quote, Wands did not proclaim that all broad claims to antibodies are necessarily enabled, unquote. The functional claim limitations here, quote, did not enable preparation of the full scope of these double function claims without undue experimentation, unquote. Amgen's claims were, quote, far broader in functional diversity than its disclosed examples, unquote. And, despite the progress in the field, were still situated in an, quote, unpredictable field of science, unquote. So you can see there is much unknown, and there were attempts made to write patents to cover the unknown. But there was obviously pushback. That's my interpretation of this at this point in time. All right, I'll probably revisit this later. But you can see this tug of war here. A person of ordinary skill in the art, it concluded, could only discover the claimed embodiments through massive trial and error or accidental discovery. The court saw broad functional claims coupled with narrow guidance and concluded that no reasonable jury could find, quote, anything but substantial time and effort would be required to reach the full scope of claimed embodiments, unquote. This seeming repudiation of Wands, and by extension of genus claims in the life sciences and chemical fields, reflects a fundamental reorientation of the Section 112 jurisprudence. It imposes a new requirement that a patentee teach the PHOSITA, that's the person having ordinary skills in the art, how to identify every working claim in the genus rather than just teach people how to find working examples in the genus. This novel requirement is at odds with the rule in other countries, and it has been subject to academic criticism, including from one of us who has argued that it represents, quote, the death of the genius claim, unquote. On a petition for rehearsing en banc in Amgen, Judge Lorie, L-O-U-R-I-E, took the unusual step of writing a concurrence to the panel's own denial of rehearing, perhaps to address such criticism. In his concurrence, Judge Lorie asserted that, despite arguments to the contrary, there was no change in the law. Patentees could still obtain genius claims, provided that they show enough working examples. Notably, however, there were 26 working examples in Amgen and 300 working examples in AbbVie. In Amgen, that still was not sufficient written description for the Federal Circuit despite a jury finding to the contrary. Nor did the jury's factual findings that persons having ordinary skills in the arts could identify other working antibodies move the court in either case. While the immaturity of the art was the central inquiry in Wan's and earlier cases, Amgen and AbbVie suggested that scientific advances in the areas and the realities of undue experimentation are irrelevant. The requirement to disclose structure is entrenched as a matter of law. To put it more bluntly, it doesn't matter how many antibodies the patentee discloses or how much of a roadmap the patentee gives to finding other embodiments. Without proof of something that the science just doesn't support, evidence that antibodies that bind to particular epitopes with particular affinity must have parallel structures, it's impossible for a functionally defined antibody to claim to survive. Indeed, it does not seem that a single antibody case from the modern era has survived Amgen's approach to enablement or written description. Juno Therapeutics Incorporated versus Kite Pharma Incorporated cements the court's structural turn. Juno concerned a remarkable application of immune receptors, re-engineering patients' T cells to produce chimeric antibodies that specifically target their unique blood cancers. The technology, chimeric antigen receptor T cell therapy, or CART, C-A-R-T, is arguably the first true gene therapy approved by the Food and Drug Administration. Although Kite Pharma was the first across FDA's finish line, Juno Therapeutics, in conjunction with Sloan Kettering, Memorial Sloan Kettering Institute for Cancer Research, New York, we talk a lot about them on Houstonic Live, had conducted early research in the area and patented its innovations. These innovations concerned novel ways of linking the engineered antibodies, CDR, and constant regions together in a manner that further stimulated the immune system to fend off cancer. Juno subsequently sued Kite Pharma for infringing its patents with Kite's Yescarta, Y-E-S-C-A-R-T-A, product. A jury found that the claims were adequately described. On appeal, however, the Federal Circuit reversed, finding that Juno's patent for nucleic acids including chimeric T-cell receptors was invalid as a matter of law for lack of written description. The patent included dependent claims that covered the technology as used in single-chain antibody variable fragments, or SCFVS, a structural genius of the antibody claims written broadly. Nonetheless, the court held that the claimed genius, the asserted patent, failed to disclose, quote, representative species or common structural features to allow a person of ordinary skill in the art to distinguish between SCFVS, which is single-chain antibody variable fragments, that achieve the claimed function and those that do not, unquote. This was so even though the Amgen 190 patent disclosed two working examples of SCFVSs, albeit without disclosing the amino acid sequence of either. The court noted that the amino acid sequences not being disclosed would not have been fatal if the patent had, quote, provided other means of identifying which SCFVS would bind to which targets, such as common structural characteristics or shared traits, unquote. But that seemed unlikely, given that the court's definition of the functional genius, anything, which is anything SCFVS bound to their targets, claimed potentially quadrillions of candidates. Quadrillions. We're not talking 2 or 3 different antibodies. Quadrillions. Quadrillions means customized, personalized, even personalized in multiple different ways, possibly within the same person. Excuse me. Remarkably, the scFvs fragments were not even the inventive part of the patent. The point of novelty was the double inclusion of the zeta chain. Oops, excuse me. Let's see here. Why did that happen? Sorry about that, everyone. Yep, that is my wake-up alarm because I need to get going in a minute. See, are we just about done with this section here? Almost done. Yes, last little paragraph here. Remarkably, the scFvs, that's a single chain antibody variable fragments. Remarkably, the scFvs fragments were not even the inventive part of the patent. The point of novelty was the double inclusion of the zeta chain and the co-stimulatory region. Nonetheless, the Federal Circuit required the specification to demonstrate possession of all possible variants of all elements of the claimed invention, not merely its novel elements. So we're going to wrap it up there for now. That is Section 2, Part C. The next, when we resume, it's going to be Section 2, Part D, which is fairly short. That's antibody claims in the courts today. And probably in our next video, we'll continue going on to starting Section 3, which is what's going on here, where we'll get to some more and more summaries as written in this report. Again, if you think no one's read this report, Gorsuch, United States Supreme Court Justice, probably one of the sharpest people on a lot of these topics, as well as 5G issues. And I have heard indirectly, well, actually through Scott McCullough, that Gorsuch is him and his team, because he represents the team basically, is one of the only people that really, really gets a lot of the wireless communication acts, which are being reviewed right now by the United States Supreme Court. So, Scott McCullough actually speaks very highly of Gorsuch. So perhaps we have a real good one there. Someone who is maybe not, I wouldn't say fighting for the little guy, but trying to do the right thing in the big picture. I'm really excited about that possibility. So this has been sourced amongst probably countless other things by Gorsuch. Hence, the timing of this article in February of 2023 was probably very intentional, so that it could be used as input amongst innumerable other things to new rulings which are now underway in the United States Supreme Court. It's not just us reading it as little independent citizen journalists on the internet. So with that said, everyone, thank you for your time. 58 minutes in. Have a great day. I have been making a playlist for this so that on BitChute or Odyssey, and soon I'll reproduce it on YouTube. You can just click and start on the first episode, and it will play all the way through. And we also have a page right now on for this playlist on Houstonic.live. Thank you, everyone. Take care. Have a great day. Be positive, and God bless.